Today we are going to discuss a very important topic, which is about thoracic outlet syndrome. But before coming to our main topic, you should know the boundaries of thoracic outlet. So in this diagram, there is cervical vertebrae, thoracic vertebrae, manubrium sternum, first rib, subclavian vein, subclavian artery. This muscle is scalene anterior muscle, this muscle is scalene medius. So thoracic outlet is basically bounded medially by scalene anterior muscle, scalene medius muscle and first rib, as you can see in this diagram. Thoracic outlet is bounded laterally by axilla. Over here axilla is present, posteriorly trapezius muscle is present, scapula is present, anteriorly clavicle is present. Clavicle, coracoid process, deltopectoral fascia, pectoralis minor muscle. All these structures comes anteriorly. As you can see in this diagram, subclavian artery runs posterior to the scalene anterior muscle and subclavian vein runs anterior to the scalene anterior muscle. So after that these vessels, they run below the clavicle in front of the first rib and enters into the arm. So you can say that thoracic outlet is basically a pathway along which the neurovascular bundles pass, like brachial plexus, subclavian vein, subclavian artery. Now let us talk about true neurogenic thoracic outlet syndrome. True neurogenic thoracic outlet syndrome occurs as a result of cervical rib and C7 elongated transverse process, in which there is paresthesia and pain along the middle border of the arm, and there is also muscle weakness, and muscle can goes into atrophy. So true neurogenic thoracic outlet syndrome basically occurs as a result of cervical rib and C7 transverse process. What is vascular syndrome related to thoracic outlet? It can involve subclavian artery, axillary artery, it can involve subclavian vein. Arterial involvement occurs as a result of compression of subclavian artery or axillary artery with the arm motion or overhead activities. And vascular involvement like subclavian vein can be involved if there is some blockage in the subclavian vein, either in the form of acute thrombosis or in the form of effort thrombosis, and in such case there is painful swelling and bluish discoloration of the arm. What is etiology of thoracic outlet syndrome? It can occur as a result of compressive neuropathy, it can occur as a result of faulty posture, it can occur as a result of entrapment of neural tissue from the scar tissue or pressure. Compressive neuropathy is basically the compression of neurovascular bundles. These neurovascular bundles can compress if the surrounding structures or surrounding muscles get hypertrophied. Like there can be hypertrophy of scalene anterior, medius and pec minor muscle over here. As a result of hypertrophy of these muscles, there is decrease in the size of the area through which brachial plexus and subclavian vessels pass. Second cause of thoracic outlet syndrome can be faulty posture. Faulty posture can be forward head with increased thoracic kyphosis, protected scapula, forward head posture. All these positions or faulty posture, poor posture, narrows the space through which the neurovascular bundle pass. So it can also result in the thoracic outlet syndrome, or shortening of scalene pec minor muscles can also compress the neurovascular tissue. And third cause that can result in thoracic outlet syndrome is entrapment of neural tissue from the scar tissue or pressure. So compressive neuropathy, faulty posture and entrapment of neural tissue from the scar tissue can result in thoracic outlet syndrome. Now let us discuss different sites of compression of neurovascular bundles over the thoracic outlet. So first area is interscalene triangle area. As the name is telling, interscalene triangle area is present between the scalene anterior muscle, scalene medius muscle, and the first rib. Second is costoclavicular space. Costoclavicular space is a space that is present between the clavicle, subclavius muscle. As you know, on the inferior aspect of the clavicle, subclavian muscle is present. So this space is present between clavicle, subclavius muscle, costocoracoid ligament, and the first rib. So between the clavicle, first rib, subclavius muscle, and costocoracoid ligament, costoclavicular space is present. Third space is retropectoris minor space. This space is present between the pectoris minor muscle and first four ribs. So over here these bundles can be compressed. What are common impairments that can result in thoracic outlet syndrome? As you know, if the brachial plexus is involved, there can be paresthesia, numbness, weakness, discoloration, swelling, muscle length, strength imbalance can occur, faulty posture can occur, poor endurance in postural muscle can occur, and there is also shallow respiratory pattern that can result in thoracic outlet syndrome. Poor clavicle and first rib mobility can occur in thoracic outlet syndrome, and neurological symptoms can appear. There are also some functional limitation and activity limitation, participation restriction in thoracic outlet syndrome. What are those? There can be sleep disturbance, inability to carry heavy backpacks, briefcase, inability to maintain prolonged overhead activities, inability to sustain overhead work. All these activities can be restricted.
Addison test. The therapist is standing beside the patient and the patient is mindfully in the sitting position or the standing position. Shoulder abducted 30 degrees, elbow is extended. Ask the patient to rotate his head towards the affected side. Take the hold, deep breath and hold. If the palpate the radial pulse. If the radial pulse is reduced, the test is positive and patient is having the thoracic outlet syndrome. Military brace test. Shoulder extended 30 degrees. Neck is extended. Head is extended. Elbow is extended. Take a deep breath. Palpate the radial pulse. If the radial pulse is having change in it, the patient is having the thoracic outlet syndrome and the test is positive. Bruce test. The therapist is standing beside the patient and the patient is in the standing position. Shoulder abducted. Elbow